Assalamualaikum doctors. In this video, I am discussing a clinical Ehler-Danlos syndrome. So Ehler's Danlos syndrome, it is other cases come not tall, not short, not obese, only hypermobility. Remember, only hypermobility, that is a clue, and other features are, look, there is skin, that is pepper scar, more prominent in the forehead and the lower limb, you will find. And hypermobility sign Byton score we are seeing, these are. Okay. So features are 4P, pes planus, pepper scar, that is more prominent in the forehead and the lower limb. Bruises. Ask the child to pull his skin. Skin hyperelasticity. So Ehler-Danlos syndrome, it is an autosomal dominant condition. Signs are proportionate tall stature or normal height. Number 1. Number 2, normal mentality. Number 3, they have hypermobility. Byton score 4 out of 9 or more. 4. There is skin hyperelasticity. Ask the child to pull his neck, skin like you are doing. So we'll tell the child to do that. Number 5, skin bruises, cigarette paper scars. 6, high arched palate. 7, there is pes planus, high arched palate. Okay. And 8 is scoliosis or lordosis. Number 9, cardiac aortic root dilatation or mitral regurgitation. So there are lots of features we are seeing. And discussion in case of a proportionate tall stature for DD. DD, what we tell, Ehler-Danlos syndrome, Fragile X syndrome, Sotos, Marfan acromegaly, familial tall. I would like to complete my examination doing the cardiovascular system examination, others joint examinations, blood pressure monitoring. How will you manage? Okay, I will take the full history and revise his previous notes and run some tests. History to ask the mother about similar condition in the family. Yes, Ehler-Danlos syndrome is an autosomal dominant conditions. Pain in the physical education classes, any heat-related symptoms or bleeding problems, swallowing disorders due to gastroesophageal reflux disease, hypermobility in the temporomandibular joint. Mode of inheritance, it is an autosomal dominant conditions, Ehler's E3 collagen D type 3 and osteogenesis imperfecta, that is also collagen I, collagen D type 1. So collagen disorders are Ehler-Danlos syndrome and osteogenesis imperfecta both. So in case of Ehler-Danlos syndrome, follow the tall stature approach. Okay, the most common type of Ehler-Danlos is 10 types. Classical severe form, premature rupture of the membranes and preterm birth, normal life expectancy may be mitral valve prolapse. Hypermobility, there is prominent features of hypermobility difficult to distinguish from the generalized joint hypermobility. Vascular is rare, thin, easily bruised skin, fragile blood vessels can cause serious complications. Advice what we give, advice related to hypermobility: avoid trauma, avoid contact sports, easy bruising, and avoid hot weather. Okay, it is an autosomal dominant condition, we know that. What is the investigation we do for Ehler-Danlos syndrome? First of all, diagnostic, that gene test may be autosomal dominant, autosomal recessive, detect in collagen type 3. Lab is full blood count, we are doing coagulation profile, bleeding time prolonged due to defect in the platelet aggregations. Radiology, we are doing X-ray of the left wrist for bone age, echo for aortic root dilatations and mitral valve prolapse. Spirometry and geometry, geometry, if scoliosis, developmental assessment. Team is involvement, my consultant pediatricians, physiotherapist, occupational therapist, speech and language therapist, that is SALT, genetics, counseling for the family, hematologist, cardiologist, liaise with the school regarding physical education classes. So multidisciplinary team, there is a very big list. Consultant pediatrician, physiotherapist, okay, occupational therapist, SALT, genetic, then counseling for the family, family counseling as genetic conditions, hematologist and cardiologist, and liaise with the school regarding PE classes. So this is all about Ehler-Danlos syndrome, autosomal dominant condition, collagen disorder. Thank you.